Ischemic stroke. This is the most common type of stroke, responsible for roughly 87% of all cases. It occurs when a blood clot blocks or narrows an artery leading to the brain, cutting off the supply of oxygen and nutrients to a specific region. Within minutes, brain cells in the affected area begin to die. The clot can form directly inside one of the brain's arteries, often at a point where plaque has built up over time. Or it can travel from elsewhere in the body, typically the heart or the large arteries of the neck. The symptoms depend on which part of the brain loses its blood supply. One person may lose the ability to speak, while another may experience sudden weakness on one side of the body or lose vision in one eye. Time is critical with ischemic stroke. There is a narrow window, usually 4.5 hours, during which a clot-dissolving medication can be administered. Every minute of delay means more brain tissue lost. Beyond medication, procedures to physically remove the clot have become increasingly effective, extending the treatment window in some cases to up to 24 hours.
Hemorrhagic stroke. This type occurs when a blood vessel in the brain ruptures and bleeds into the surrounding tissue. The leaked blood puts pressure on nearby brain cells, damaging them, while the areas beyond the rupture are simultaneously starved of their blood supply. Hemorrhagic strokes are less common than ischemic strokes, but tend to be more deadly. There are two main subtypes. An intracerebral hemorrhage happens when a vessel inside the brain itself bursts, most often as a result of long-standing high blood pressure that has weakened the artery walls over time. A subarachnoid hemorrhage occurs when bleeding happens in the space between the brain and the thin tissues covering it, usually caused by the rupture of a small balloon-like bulge on an artery, known as an aneurysm. The hallmark symptom of a subarachnoid hemorrhage is a sudden, catastrophic headache, often described as the worst headache of a person's life. Treatment for hemorrhagic stroke focuses on controlling the bleeding, reducing pressure in the brain, and stabilizing the patient. Surgery may be needed, depending on the size and location of the bleed.
Transient ischemic attack. This is often called a mini-stroke, and while the name suggests something minor, it should be treated as a serious medical event. A transient ischemic attack happens when blood flow to part of the brain is temporarily blocked, usually by a small clot that dissolves on its own within minutes. The symptoms are identical to those of a full stroke: sudden numbness, confusion, trouble speaking, vision changes, or loss of balance. But they typically resolve within an hour, and almost always within 24 hours. The key word is temporary. No permanent brain damage occurs during a transient ischemic attack, but that does not mean it can be ignored. It is a warning. Roughly 1 in 3 people who experience a transient ischemic attack will go on to have a full stroke, and for many, it happens within days or weeks. Seeking immediate medical attention allows doctors to identify the underlying cause and begin preventative treatment before a more devastating event occurs.
Cryptogenic stroke. This term refers to a stroke whose cause cannot be determined even after thorough investigation. The word cryptogenic literally means hidden origin. It accounts for roughly 25 to 30% of all ischemic strokes. Doctors run through the standard workup, imaging the brain and blood vessels, monitoring the heart rhythm, testing the blood, and still come up empty. This is frustrating for both patients and clinicians because knowing the cause is essential for choosing the right prevention strategy. In many cases, the suspected culprit is a heart rhythm abnormality called atrial fibrillation that was simply not detected during the initial monitoring period. Other possible hidden causes include small holes in the heart, plaque in the aorta, or blood clotting disorders. Advances in longer-term heart monitoring and more detailed imaging are gradually shrinking the percentage of strokes classified as cryptogenic, but it remains a significant challenge in stroke medicine.
Brainstem stroke. This occurs when blood flow to the brainstem is disrupted, either by a clot or a bleed. The brainstem sits at the base of the brain and connects it to the spinal cord. It controls many of the body's most fundamental functions, including breathing, heart rate, blood pressure, swallowing, and eye movements. A stroke in this area can produce devastating and complex symptoms. Some people experience vertigo, severe dizziness, double vision, slurred speech, or difficulty swallowing. In the most extreme cases, a brainstem stroke can result in a condition called locked-in syndrome, where a person is fully conscious and aware, but unable to move or communicate except through eye movements. Despite its severity, a brainstem stroke can sometimes be missed initially because its symptoms can mimic other conditions like inner ear problems or migraines. Because the brainstem is so compact and densely packed with critical pathways, even a small area of damage can have outsized consequences.
Cerebellar stroke. This type affects the cerebellum, the structure at the back of the brain that coordinates movement, balance, and fine motor skills. A cerebellar stroke can be ischemic or hemorrhagic, and its symptoms are often different from what people typically associate with stroke. Instead of one-sided weakness or speech problems, a cerebellar stroke tends to cause sudden, severe dizziness, loss of balance, nausea and vomiting, difficulty walking, and problems with coordination. These symptoms overlap heavily with much less serious conditions, which means cerebellar strokes are frequently misdiagnosed in the early hours, sometimes being attributed to a viral illness or an inner ear infection. This delay in diagnosis can be dangerous because swelling in the cerebellum can compress the brainstem, turning a survivable stroke into a life-threatening emergency. When identified and treated promptly, many people recover well from cerebellar strokes, though balance and coordination problems may persist.
Lacunar stroke. This is a type of ischemic stroke that affects the small, deep arteries within the brain. These tiny vessels supply blood to structures deep inside the brain that handle motor control, sensation, and coordination. When one of these small arteries becomes blocked, the resulting area of damage is small, typically less than 15 millimeters across, and is called a lacunar. The symptoms can be surprisingly specific. One common pattern is pure motor weakness affecting the face, arm, and leg on one side of the body, without any sensory or speech changes. Another is pure sensory loss without weakness. Because the area of damage is small, lacunar strokes are often less immediately devastating than larger strokes, and recovery can be good. However, having one lacunar stroke significantly increases the risk of having more. Over time, multiple lacunar strokes can accumulate and lead to a condition called vascular dementia, where thinking and memory are progressively affected. High blood pressure and diabetes are the two most important risk factors.
Spinal cord stroke. This is a rare but serious event that occurs when blood flow to the spinal cord is interrupted. Unlike brain strokes, spinal cord strokes do not cause problems with speech, vision, or thinking. Instead, they affect the body below the level of the injury. Symptoms can include sudden severe back pain, weakness or paralysis in the legs, and loss of bladder or bowel control. Because the spinal cord carries signals between the brain and the rest of the body, even a small area of damage can have significant consequences. Spinal cord strokes account for roughly 1 to 2% of all strokes and can be caused by blood clots, ruptured blood vessels, severely low blood pressure during surgery, or compression of the arteries that supply the spinal cord. Diagnosis can be challenging because the symptoms can resemble other spinal conditions. Recovery varies widely depending on the severity and location of the damage, and rehabilitation is often a long process focused on regaining as much function as possible.
If you found this video helpful, make sure to hit that subscribe button and turn on notifications so you never miss a new upload.